And there we go. Good morning, everybody, and welcome to Dental Voice. My name is Rolando Mia, and this is Xyrus. Today, we have a special guest. Kind of excited to get some insights from Dr. Igor Landsberg. When you look at Xyrus, we work with literally thousands of clinicians, and there's a whole ton of information, experience, and wisdom that they have. What we have with Dr. Igor is a young dentist who just recently graduated from Stony Brook, finished his residency down in Long Beach at the VA over there, and just started his career. So this is going to be fun. Really looking forward to spending some time with you. Welcome, Dr. Igor Landsberg. How are you doing, sir?
I'm doing well. Currently in Santa Barbara. Yeah, thanks for having me on.
Oh, no problem. So what I'd like to start with, first of all, is kind of your experience so far. When you were in dental school and going through and then, starting in your residency, COVID-19 didn't exist whatsoever. So from your perspective, how would you say it's affected kind of the experience that you're dealing with right now, and what are your thoughts on that?
Yeah, I mean, it's completely different than dental school and even residency. We had a lot of infection control classes and lectures and kind of all of that. They had to bring us up to date and, really teach us the basics, right? But it was something that I think students really, they didn't want to really listen to that as much as, the clinical hands-on stuff, right? So it's always in the background. We know what's the clean side, what's the dirty side. I finished Stony Brook knowing what I need to do with airborne pathogens and bloodborne pathogens and stuff like that. But this is really just completely changed. Me as a new dentist now working 2 to 3 days a week. I really have to be aware of what's really going on and how to really take the basics that I learned and really apply them, So, yeah, it's more like instead of the clinical knowledge that we got, it's more of the stuff that we didn't really pay attention to too much and really applying it now.
Well, I appreciate that. And I can only imagine from an operational perspective, you were taught certain things in dental school. And the VA is phenomenal at infection control and maintaining a very stringent level of that. What is it? How do you see, or what has changed from your perspective, and what are you personally doing to kind of make sure that you're safe, your patients are safe, that type of stuff?
Yeah. Well, now we obviously, before we wore masks and we wore loupes, and we again had all the basic protection that every student and every dentist wears. But now with COVID, N95 masks are a priority. Face shields are a priority. We really have to be aware of what we touch, and if we adjust our loupes, or we have to be aware for not just our safety, but for the patients and for the assistants, for the staff. So it's more of just being prepared, going from patient to patient. We limit the amount of patients that we see now, so at least we have more time to kind of prepare and adjust ourselves and see the new patient and make them feel comfortable, make us feel comfortable. Right now we test every patient. We check their temperature. Before I go in, I kind of have the assistant see them first, and so I have the assistant ask them a few questions, whether or not they kind of been staying inside, or if they've been kind of exposed to anything unnecessary. So we have to really take really serious precautions here. So that's the really big difference. I'm sure a lot of people know. So
yeah. So you've got a lot of dentists right now who are, about to graduate from dental school, or in the midst of their residency. Based on what you kind of experienced so far and the things that you've been dealing with, what advice or what kind of feedback would you want to give those dentists? First, the ones who are in dental school, who are about to come out, and then the dentists that are in residency, who are probably going to start looking at and trying to figure out how to start their career. So what advice would you give those folks?
I personally think it's going to be really challenging to find a job, I think. Not saying it's going to be completely impossible, but I think it's going to be harder than when I was looking for a job, for example, right? And I was in a pretty interesting situation because I actually just started a new job March 16th. So right before everything blew up, wow. My first day in a new office was March 16th. So I'm still a new dentist, right? In the eyes of many, and in my eyes. So it's like, let's say I just came out of residency, right? And I started this new job, and this whole thing blew up. And now what, right? I was promised, I have a certain daily guarantee, right? Because I don't have my own patient base. So that was thrown out the window. A lot of the promises, a lot of the things that were supposed to happen really, didn't pan out, didn't go through. So I think, for a new dentist, if they get a new job, we have to realize that this is a reality. Even going forward, several months to even a year, this is what life is going to be like, and for the dental profession, really. Caution, really being prepared for seeing mostly emergencies, I would say. I know we have to get back into the flow of really doing regular dentistry and stuff like that, but sorry, I kind of lost my train of thought. But I think
so if I understand, you have to be prepared because the reality is quite different, right? From what you thought it would be. And yeah, it's definitely going to be hard, but it's also, there's a perspective that you have to have going into this. Is that kind of where you were going with that?
That's right. That's right. As a new dentist, you're always kind of swayed and you're persuaded, right? I would say stick to what you know. You're a dentist, you know a lot, okay? You have your own morals, your own ethics. So whatever anybody really says, have facts behind you, right? Have a conversation with the person that's trying to employ you, who you're working with, and say, listen, I'm not comfortable with this because of A, B, and C, or I think it should be this because A, B, and C. That's what I really kind of did. I had to step up in my dental practice, being a really brand new in the office. We had other doctors there. They kind of, they didn't want to work in the current environment. And so I really had to step up. I had to be the one that led the staff, that led the dental assistants, and I dictated who I wanted to see. I had a lot of conversations with my employer, what he wanted from me and what I told him I'm comfortable with. And, everything was by, CDA guidelines and everything like that. But he respected that, I think. So I think for a new dentist or coming out or, even in residency, just be confident in what you believe in. And, and I think it'll work out. It's just nobody really knows how to handle all of this. So nobody's right, really. Just be cautious and be protected. So
that's great. I really appreciate that. It's amazing. It requires courage, and I think that's a key piece that I got out of there. And then confidence in what you've learned, and basically have the ability to have an open and meaningful dialogue with those around you. Did I catch that right?
You did.
Awesome. Pardon?
That was very well said on your part.
So how do you, because it is completely different. And, when you think about change, when you think about things that you never expected, the prospect of not knowing about really can lead to a lot of stress and anxiety. How is that affecting you, and how is that making you feel right now?
Um, I wasn't too worried with everything that was going on. I'm a young guy, obviously, like, I'm not in much danger, if I get exposed, but it's those around me, right? I don't want to spread it around.
Right.
So, that always it was always in the back of my mind. What if I do get infected? What if is my staff exposed, or my, the patients, the dental assistants, when I come home, or my neighbors, and,
Right.
I'm still, I see my neighbor, we walk past each other. So, it's that stuff that I'm concerned about, really. And, I mean, I don't know if I answered that question, but at least the knowledge of the unknown. I mean, we still don't know a lot about this, whether it's in, how it's really going to be controlled in the future. So I think a lot's going to change, and
Yeah.
it's kind of going to be interesting after that.
That's cool. How do you keep yourself and your team motivated? How do you, because you're the dentist, you're the person that I'm looking to. I'm part of your team, and I'm looking for you to kind of say, "Hey, come on, let's go." How do one, keep yourself motivated? How do you keep yourself up, and then how do you motivate your team? What are some of the things that kind of you think about when you do that?
Well, when we see a patient, they're so appreciative of anything we do, even if they, we're seeing a lot of emergencies, a lot of limited exams when they come in and we get them out of pain, or at least just do an exam and kind of talk them through whatever they need. They're so thankful, because everybody really knows what's going on, right? So that's really kind of, coming back in and seeing those emergency patients that have a swelling, or, they can't sleep at night, they can't eat, they can't function. That's, I would say, what's really motivating me. I don't, there in the beginning of all of this, obviously the dental profession is super exposed, right?
Right.
And a lot of offices closed. I think right now, I just heard a statistic: 76% of dental offices are closed, and that's putting a lot of unnecessary stress on the emergency rooms and everything like that, and other patients, and they just don't know where to turn. So when we think about everybody that we're helping, that kind of pushes you forward. We're essential. I mean, dentistry as a medical field. I mean, I don't know if you've ever been in dental pain, but it's not fun.
You're talking to one of the worst patients on the planet, because it's, I work in the industry, and I completely understand and resonate with that. But you're right. When you are in pain, and you come in and I see you, doctor, and you help me, it's very gratifying. It just feels great because you're doing that. So I can totally see how that can be very motivating and helpful to the team. So thank you for that. Appreciate that. Yeah, that's kind of cool. So, it's interesting. You mentioned there's so much information out there. There's so much that you're hearing. I suspect that there's a component of it that's real, and there's a component of it that's speculative, and then there's a component of it that's probably all just total, just not even true. What advice would you give people regarding what to listen to and what not to listen to, and all that type of stuff?
We're all, I think you have to kind of absorb the information as you can, right? I mean, there's a lot of speculative data out there. I know some people that are not really they don't even believe that aerosols transmit the virus. So, I mean, that's a little, I think, extreme, especially, if we're in the dental field. But, it's kind of everything that you take, think about it, right? Even if it's speculative, right? I mean, there's so much that's happening. It's spreading so fast, and you want to stay protected. You want to protect everybody else. So just take the necessary precautions and be safe. I work with the ISOVAC in the office. Okay, I know how much aerosols and how much splatter there is when we work in the patient's mouth. So I want to reduce that. Let's say, I don't know. I mean, for those that don't believe that the virus can be transmitted, I mean, they don't work with, they don't try to protect themselves that way. You know, they still use the N95 mask, hopefully, but I want to go the extra mile. You know, I want to protect everybody around me. I just actually found out maybe last week that two of my assistants have underlying conditions. So one of them has asthma and the other one has diabetes. And I'm like looking at and I didn't realize that because again, I'm new. I'm, you know, still trying to remember all the names, but you know, I'm like, what are you guys doing here? And then, you know, they need the money, they need to work, obviously, you know, so I can't blame them for that. But if whatever we can do to really minimize any type of unnecessary exposure, we have to. Okay. So, and I think that's where dentistry is really going to. You know, there's studies show that this stuff, the aerosols stay in the air, suspended in the air for hours. You know, I don't know how the ventilation systems are in most offices, but I don't think they're great. You know, right. There's really nothing we could do about that. So, you know, let's say we completely gown up and have all of the protection and everything, right? And then it's still in the air. There's not a breeze. We're not outside. There's not a breeze that's taking these particles down somewhere else. They're out there. So I think the danger is there. And I think we have to be aware of it. We have to read up on it. So whatever's unknown is going to be known, hopefully sometime soon. And listen, before we have any kind of concrete serological testing, we just have to be prepared. I mean, there's asymptomatic patients walking around everywhere, you know, even taking a temperature, you know, even asking how you know, have you been sick lately, or, you know, we might still be, you know, we might still be exposed. We might still be, you know, exposing everybody around us. So take it as is, just be well prepared.
So that's cool. It's interesting. In the absence of information, it sounds like, or if I got this correctly, it's important to be completely prepared. Kind of the context of prepare for the worst, expect for the best. Is that kind of the logic behind it? Make sure you're completely prepared. Make sure you're protected. Ask the questions.
I think so. I think think that's how dentistry is. It's completely changed, right? Everybody's talking about it. What's going to happen, right? I mean, there's some that believe that our basic PPE is going to be fine, and it's you know, maybe obviously with an N95 mask, but there's those that think that we have to be in complete suits and complete, you know, masks and
scuba outfit.
Exactly, it's crazy, right? But we also have to realize that, you know, this happened before, right? This happened with the Spanish flu 100 years ago. Right. And what happened with the Spanish flu? It just didn't just disappear. I'm sure people took the same precautions. They were, you know, staying away from each other and everything like that. But it basically just faded away. Right. More and more people got exposed to it. Right. And so I don't think dentistry needs to change. And I don't know how I got into this topic.
No, this is great.
I don't think that needs to really change completely and entirely their protocol in terms of just wearing suits and getting, you know, kind of getting into like the operating room, but you know, being more prepared than usual, being more aware, at least right now, before we could do any kind of testing, before we could know for sure that whoever's coming in is safe and we're not in any harm. Even you know, I got to test ourselves as well. I think we're kind of doing that, and we should strive for that. I mean, that's my thought on it. I kind of been watching a lot of you know, other lives with other dentists who you know, everybody has an opinion on this. Everybody has an opinion, and even in my own company, there's, you know, contrasting thoughts. And what should we do, and how, you know, little by little we should see more patients and you know, try to do that. But again, it's like, if you're not protecting, or at least trying to protect as best you can those around you, I mean, we're trying to do the greater good. Everybody's making sacrifices in the entire community. So if there's pockets of places that are really not abiding by that, that's kind of, it's not right. I think it's irresponsible. So.
No, appreciate that. And, you're right. There are always going to be contrasting views. You're going to have people who are completely freaked out, and then people who are saying, yeah, this is kind of crazy. And if I hear it correctly, based on what you said earlier, it's important to be clear who you are and have the courage to kind of drive it from that perspective, right? And I like that. I love that message, because it's it's not about just just blanket believing. It's taking that information in and making sure that you kind of balance it with what your thoughts are. So thank you for that, and I appreciate that. So you mentioned that you use the system, the ISOLITE, or the ISOVAC or system for that. Do you see it actually decreasing or helping with aerosols and spatter and all that type of stuff? Have you personally seen it? Did you have you used it before, that type of stuff?
I used it in dental school, in Stony Brook a little bit, and I remember I really loved it. After that, I didn't use it. I didn't use it in my VA, or for the half a year, more than 8 months that I worked in a different practice. But now I got it in this office, and I can't really. I mean, I know what it does, and I know how much it reduces, and I could see it helping me a lot, because just clearly I can't see the aerosols in the air,
Right.
But I mean, I know how much it helps me see, and it helps reduce any kind of saliva that's ejected out of the mouth, right? So at least that's if I've answered any of your that question.
No, you have. See, because one of the things we're hearing is constant evacuation is really important, because even as a patient or as a person is breathing, they're actually generating aerosols. And when you think about COVID, it kind of starts in the lungs. And the important part, I think it was Rella Christensen who's been a huge advocate. We had another clinician, Michelle Strange, on, and she was saying, you know what? Anything you can do to minimize the potential for aerosols escaping from the patient, you want to do that. Especially, you mentioned some of these patients are asymptomatic. So you could be treating me, and I could be a carrier, and you don't know. So I think that was kind of the thing. So
yeah, I think it's advised by the ADA to use a rubber dam for emergencies. I think the ISOVAC it just does that just as well. It acts, it covers the throat, and we know that you're kind of breaking up a little bit. I know the corona is, the virus is in the nasopharyngeal mucosa. It's in saliva, right? So if we could prevent that, that splatter in the air, why not? I mean, we need to.
Yeah.
As healthcare professionals, we're obligated to be safe and make sure the patient is safe. So, and again, I said that now there's a study that I actually read yesterday. It's in the New England Journal of Medicine, that they believe that it could even be spread by speaking, by just speaking. I mean, the aerosol particles are large when you cough and you sneeze, but there's certain droplets or air particles that are just they emit when you speak. So they were saying they're testing it with lasers, and they're saying, like, stay healthy. And so when you say "th," it's they have these little particles, the particles that are, and they're actually, according to the study, they're so little, so small, that they stay in the air longer, because the gravity just doesn't take them down. So I mean, if we could reduce any type of splatter, that's we don't have ventilation systems, good ventilation systems. I don't think we have to kind of go into the future. I don't know if dental offices are going to have to get a whole new ventilation system installed. The whole structure has to be changed, but I think that's a little too dramatic. I think in time, like I was saying before, in time, I think it's going to go past. I think enough of the population is going to get it and develop antibodies that we're going to get to. It's going to become a thing of the past, just like with the Spanish flu. Because I mean, if the Spanish flu never went away, we'd have been in mask right now. We would have been
That's right. That's right.
now. So it's like, a few years have to pass, I think, for enough of the population to get it. Then we're going to be we're going to feel comfortable again. So yeah.
Cool. Thank you for that. Thank you. So shifting gears slightly. So we're experiencing this now. You're early in your career. I suspect you have aspirations to, you're going to start your own practice or join another one, all that type of stuff. Based on everything that you're experiencing now, how has this changed that perspective, and kind of what are some of the shifts in your thinking with regard to how you go forward and navigate through this?
Yeah, I mean, right after residency and starting practice, I always imagined, having a dental office. When can I get a dental office? And I always encouraged young dentists, and I was encouraged to become an owner, because that's how you grow and that's how you have, like full autonomy. And I mean, that's really the goal, right? With all of this moving forward, I think that has to kind of be dialed down back a little bit. I think it's going to get harder, personally. I don't know about everybody else, but at least I'm eating through my savings right now.
Right.
Working only 2 to 3 days a week. But I think, for those that want to start new offices, new practices, it's, again, a lot of things need to be considered, right? And I think being well prepared, being protected and showing that the patient can be protected could be a great marketing tool, right? I mean, they could get a lot of patients if they say that I have, a great ventilation system. I use the IsoLite and IsoVac. I have all of these measures that could really that are, really protect you. So I think, the patients, they're not going to forget about this anytime soon. So if they, they could really be swayed by that. So I think it's going to be harder to open up a practice. I don't think it's going to be impossible. I think, I think loans right now are super low, and then on a small percentage, but it's whatever you feel comfortable with. I mean, it's going to be a tough environment. It was always tough to open a practice. Now it's going to be even harder, right? Everybody's economically, and I mean the economy's down. Nobody's, we have 22 million people unemployed. So are people going to want to go in and do routine dental work? Should they? I don't think so. I mean, build a practice on emergency care and really on that, but it's, it's going to be tough. So that's, I think.
Yeah, no, appreciate that. It's the prospect, especially entering into a space like this. I can only imagine what it is. I really appreciate you sharing and being so honest about kind of the things that are going through your head. You're right. There's the reality of the situation is that there's a lot of unknown, and things are going crazy. And I think it's really important, and I personally believe it's really important to weigh things and then be very, focused about what that looks like. So thank you for sharing that. And I very much appreciate that you're being so honest about it. A lot of times people come on and they're like, no, this is the best, this is great, everything's okay. But there's still that reality underneath it, and there needs to be a balance. So thank you for being, just being open with us and sharing kind of the perspective that you have. A lot of times, you feel compelled to kind of ignore things, and you're not. You're also being open-minded with regard to what's out there. So as a way to kind of wrap it up or bring this back together for our listeners, and if there are any questions, all that episode, I'll ask you about that later. What kind of, how would you pull this together, and what closing statements would you have with regard to what's happening here and the advice to the young dentists, and kind of how to kind of get through this?
You're putting me on the spot for a closing summary over here, huh? I think, for the new dentists and those that are just coming out, stay positive, and stick to what you know. you might be swayed to do things that you're not comfortable with. But I think just if you're confident in your abilities and in your knowledge, you're going to have a much easier time internally, and kind of pulling through all of this. I know a lot of dentists that they're not working right now. They don't know what to do or how long they're not going to be working. But, I took a stand actually with my employer. I didn't want to really kind of, do some of the stuff that was kind of being encouraged for me or to me. And I was applauded for that. And it took, it was such a positive for me. And I spoke to a lot of friends. I spoke to my colleagues, and they were like, you did the right thing. So I would say, stay positive, stick to what you know. This is all going to pass. This is unfortunately our reality right now. But if you're well prepared, I think you're going to succeed. You're going to do well. And patients are going to respect that and applaud you for that and thank you for that. Yeah, it's kind of, that's I would say that.
No, that's, first of all, thank you so much. I love that. I love the message behind that. It ties into, and kind of the sentiment is, people don't care how much you know until they know how much you care, and you clearly care a lot. And I think that's very clear based on the comments you've given us. So thank you, and thank you for sharing, and thank you for being so open about that. So that was awesome. Well done. Awesome. So, hey, everybody, if people have questions or want to reach out to you or kind of comment, what would be the best contact information? Or are you open to answering questions if people have them and they want to contact you directly?
Yeah, of course.
What would be the best way to get to you?
Via email.
Okay. Do you be happy to share your emael to the world?
Of course. Is there can I write it?
No, just go ahead and tell us, and then we'll put it.
It's i.lants@yahoo.com. So it's i.lance@yahoo.com.
Awesome. So if you have any questions, please do that. Those of you who are here, listeners, thank you for joining us. Really appreciate it. Dr. Landsberg, I really appreciate the direct and very honest feedback that you've given us. This is awesome. And it's a time. I love the message about, hey, get yourself together, be clear about who you are, and we're going to get through this. And that's a great message to get out there. If you like the content here, or if you have any additional things that you'd like us to go through, please send us messages. So really appreciate you joining us over here. If you like this too, please feel free to share it. And Dr. Landsberg, Dr. Igor, it's a pleasure spending some time with you here. And stay safe, be well. Good luck, and I'm sure I feel very strongly that your patients really appreciate everything that you're doing. So thank you for that.
Thank you so much. Thank you so much.
All right. Take care, everybody.
All right.